Yes. So, what is the meaning of the pressure ulcer? Pressure ulcer means, first and foremost you need to think about what is the meaning of the ulcer, right. So, ulcer means if there is any discontinuity in the formation of any tissue, right. So, this is an endothelial tissue, suppose these are endothelial tissue, and if there is any break in the continuity of endothelial tissue, then we can call that as ulceration, right. And that ulcer is due to what? It is due to the pressure. So, what type of pressure? A bony prominences which is exerting the pressure between the bed and bony prominence, this skin is getting pressurized. So, whenever this skin is getting pressurized, or else we can say compressed, that time the blood vessel is not getting the that compressed tissues will not get what? It will not get the blood supply, right. Yes. So, whenever there is no blood supply, what happens exactly? If there is no blood supply means there is no oxygen supply too. So, if it is no oxygen supply means the tissues will never get oxygen. That condition will call as hypoxia, right. And that hypoxia, if it turns into the suicide of the cells, will be said as, that is hypoxic cell death will be called as necrosis. Are you understanding? So, after the necrosis, these necrosed or else dead cells will sloughed out and internal wound will be exposed. Are you understanding? Whatever the internal structure, that may be dermis, that may be subcutaneous fats, that may be ligaments, that may be muscles or inner aspect of the muscles. So, these things it is exposed when these necrotic tissues is exposed, sloughed out. Okay. So, that means the definition is, we can say the pressure ulcer as decubitic ulcer also, we can say it is as bed sore also, right. It is a localized injury where the skin or underlying tissues caused by prolonged pressure, shear or pressure combined with the shear usually over bony prominences, that leads to tissue ischemia, and later on it leads to hypoxia, and hypoxia leads to hypoxemic cell death, that is necrosis, and after the necrosis what happens? Ulceration, and this type of ulcer we will call it as pressure ulcer. Okay. Yes. So, there is a continuous pressure on the any part of the skin or underlying tissues. So, that will causes what? Reduce the tissue perfusion. Tissue perfusion means there is no blood supply to there, okay, or else there is no exchange of the fluid from intracellular to intravascular. Clear? Yes. And what is the shearing force? It is just like opposite force, where if you are making the patient to be a Trendelenburg position or else reverse Trendelenburg position, the patient's force is opposite to the bed force. Are you understanding? That time what happens, sir? Whatever the deeper tissues are there, no, that will get rupture or else that will get injured. Are you understanding? So, due to that there is lack of blood supply and all those things will happens, right. So, can you able to see this image? Yes. This is what the shearing force, that means opposite forces are making the patient's skin to be get injured, okay, that is called shearing force. Are you understanding? Yes. Getting into the risk factors. In the risk factors, we can see for the patient one who is bed confined patient, or else we can say chair confined patients, that means bedridden patients. For them there are major risks. Inability to, they can't able to move. Example, the paralysis patient we can say, or loss of bowel and bladder control. They don't have any control over their external sphincter. Then whatever the relaxed internal anal sphincter content from the bowel or from the urinary bladder, that content comes out when they are in the bedridden, right. Are you understanding? So, that these fecal matter, these urine content will makes the what type of moist? It is contaminated moist, it is not good moist. Are you understanding? It is a contaminated moist on the healthy skin, it is making to risk of pressure ulcer. Please understand it correctly. Here the risk factors is telling about that may going to happen, that means still it has not happened. Risk factors means if these risks are there, then this risk will makes the pressure ulcer. Are you understanding? So, loss of bowel control and wait for a minute. Yeah. So, loss of bowel control, poor nutrition, lowered mental awareness if they don't know when they have when they have done when they have taken the water. So, 2 to 2.5 liters per day healthy person should take the water. Okay. So, if they are not taking that much, less than 1.5 liters, then they are dehydrated, right. So, for the dehydrated patient, why they are not drinking the water? Because they are forgetting it due to the lower mental health status. Okay. And dehydration, less drinking of water, less than 1.5 liters you can say. More obese, if they are more obese, there are more risk to get the pressure ulcer. Excessive diaphoresis, excessive sweat, urine, fecal matter, these are all a contaminated moist, that will makes what? That will makes a risk for the pressure ulcer. Clear? Contaminated moist is different, healthy moist is different. Healthy moist we need to create inside the wound, that is different, I will tell you in the treatment. Yes, extreme age, that may be more than 85 years of age, already their skin is already fragile. Then if the patient that type of age, if we make them bed confined, for them easily to have this risk of getting pressure ulcer. Okay. Lastly, that is edema. Edema, that it is not a moist, it is a edema which is collection of the fluid between the skin and subcutaneous, you can think. Now, intracellular also, intercellular. So, here we can say extravascular, there is a collection of the fluid. Okay. If there is extravascularly, this fluid is, if it is collected, then it is called edema, and this edema is having highest risk to make the pressure ulcer. Okay. So, outside there is no moist, if you think there is no moist, but between the skin and subcutaneous there is a edema, fluid content. Now, if you are dragging the patient, what happens? So, it will get injured, right. So, that will also contributing for what? Pressure ulcer. Everyone understood? Yes. So, some of the same thing here also they have said. Okay, smoking, friction and shear, AV sedation, anesthesia, diabetic mellitus and all, the same thing they have said. If you are not giving the protein correctly, protein are the building blocks of the human muscles, right. So, human body building blocks is, yes, that is protein. So, you need to suggest the patient, you need to instruct the patient to have a high protein. If you are not giving high protein, then the patient will goes more deeper ulceration. Okay. Yes, if the patient is low albumin level, if they are having low albumin level means there is a low oncotic pressure. Oncotic pressure which will makes the, it will pertains and it will retains the fluid which is to be present in the intravascular. Suppose this is a intravascular, all the fluid of the blood should be present intravascularly, and that is maintaining by oncotic pressure, and the oncotic pressure is maintained by this albumin. Are you understanding? If the albumin itself less, then oncotic pressure is less, then inside the fluid will not retain in the blood vessel, and that will comes out, that is called extravascular. Are you understanding? If it comes from intravascular to extravascular, that will causes the edema. Are you understanding? That is why we should not maintain the low serum albumin level, we should maintain the normal serum albumin level. Are you understanding? About 3.5 grams per mdl. Okay. Are you understanding? 3.5 gram per dl. Yes. Next. Now, coming to the next one, the very important thing is what is blanching and non-blanching. Suppose your skin now it's a, see now now the skin is like this, okay, your skin is like this. Now for this I am pressing, okay, staff nurse or we can say that is nursing officer is checking the capillary refill, or else we can say we are checking the blanching. Blanch means what? Blanch means white. If you press, that time it will become white, and if you leave, that will become red, okay. This is called blanching. Are you understanding? So immediately it will become what? Immediately it will become red. Are you understanding? Then it is a blanching. Blanching means white if it appears when you are pressing. Suppose you are pressing here, and if it becomes white, then it is blanching. And you are pressing at the site of pressure ulcer. Here is the site of the pressure ulcer, you think. You are pressing there, and that redness is not going, okay. If the redness is not going, see, okay, redness or pinkish, here somewhere, here it is a normal skin, mine it is a normal skin, but the patient with the stage 1 ulcer, for them there is a reddened base, okay, there is a reddened skin will be there. For them, if you press them, so it will never get white, it will be red only due to the obstruction, or else we can say due to the occlusive of the blood vessels, okay. It will not escape from the skin to somewhere or else into the circulation, it will be there only, and if you are pressing also, that will not convert into white. That is called non-blanchable, okay, that is called non-blanchable. Non-blanchable. Are you understanding? So immediately if it becomes red, then we can call it as reactive hyperemia. Suppose you are pressing, and after leaving, then this overall skin will get again refill again, the red will refill again. That is called the flow of rushing of the blood to the pressure that you applied, that you are revealing now, right, sorry, relieving. When you are relieving the pressure from the site, that time the blood will rushes into that site, then it is called reactive hyperemia. Are you understanding? Are you understanding? Yes. Now the one thing they have mentioned, the non-blanchable erythema is an early sign of stage 1 pressure ulcer. Of course it is correct. Non-blanchable. Non-blanchable means what? It will never turn into white. Stage 1, red if it is there, you are pressing and it is not converting into white, then it is non-blanchable. Are you understanding? Yes. So some of the assessment, the same thing, risk factors you need to assess. You need to ask the patient, are you paralyzed, are you coma? You can't able to ask the patient to be coma, so you need to ask their family members, and you can see, assess. And is there any level of conscious by Glasgow coma scale, you need to assess, okay. Unconscious patient, heavily sedated patient, malnourished patient, malnourished, especially the dehydrated patient. So you need to check all these things. The same risk factors will come again. Clear? That you need to write in the assessment if you want to get more mark, okay. Yes. Now coming to the one by one, which is the most common site to get ulcer, okay, in the supine position. Sir, in the supine position, which area will get most common? That is the back of the, this is occiput area. Occiput area will get ulcer because you are resting your bony prominences. Your flat occiput bone is pressurizing the scalp of the back side of the head, okay. So when you are in supine position, and the same thing, the scapula, okay, the scapula, okay, this one, a plain cut which is present back of the shoulder, right, that is what? Scapula, we can say blade. And heels, another one very important is sacrum. Sacrum means that is a vertebral column, right, in the vertebrae, last second vertebrae. Which is the last second vertebrae? That is sacrum. And if I ask you, which one is the overall most common site? Overall, in any position, they have not mentioned any position. Simply they are telling which is the most common. That time also you should say that is sacrum. Clear? If they ask specifically also which is the most common for in the supine position, that time you should say that is sacrum. I hope everyone understood this one. Yes, coming to the prone position. In the prone position, shoulder, okay, shoulder is getting, and here, ear, cheeks, okay, they are sleeping laterally, sorry, they are turning their head side, okay, and but they are sleeping on their, lying on their abdomen itself, right? Yes, and there is a genitalia and knees. These are the toes, phalanges, that fingers you can say, okay, the toes. Are you understanding? Now, sir, in this, which one is the most common? Knees is the most common, and if the knees is not there, ear is the most common. Okay, these are the two important most common in prone position. They may ask you in the MCQs. Okay, please do remember. Next one, next position, sir, Fowler's position. Sir, in this also the same thing, the sacrum and prominences, and very importantly we can say ischial tuberosity. Sir, what is this ischial tuberosity? Are you people are resting, or you people are sitting, right? So how you are sitting? With the help of that bone, that is called ischial tuberosity, which is called one of the hip bone. Are you understanding? One of the hip bone. Clear? Ilium, ischium and pubis, right? In that ischium, in that ischial tuberosity, you people are resting. Clear? Understood? Yes. So which is the most common, sir, in the Fowlers or in the sitting position? That is ischial tuberosity is the most common. Clear? Everyone understood this one? Yes. Coming to the last position, lateral position. In the lateral position, which one is the most common? These are some of the names are there. You can see, you can read it, which I don't want to again and again to say, right? So which one is the most common, sir? Greater iliac trochanter. Okay. So greater iliac trochanter, that is where you can see in the which one, femur. Okay, femur, top femur, which is attached with the help of acetabulum, isn't it? That one. Greater trochanter and lesser trochanter will be there. I hope you know about the anatomy and physiology, as Grace ma'am has done that, right? Nice. Next we'll get into the stages. Now the stages, in the stages what we have to see, what are the stages of the pressure ulcer? Simple, I will tell you first I will tell you. Stage 1, no layers is get injured. Okay, only the top layer which is get to be non-blanchable and also reddened. If it is reddened and non-blanchable, then it is first stage. Clear? Second stage, epidermis is injured and dermis is exposing. One scenario. Another scenario, if it is blister, and in the blister there is some serum which is filled in it. Okay, that is the second stage. Are you understanding? Yes. Third stage is epidermis also injured, dermis also injured, subcutaneous fat is exposing. Okay, then it is called third stage. Do you understand this one? Now coming to the fourth stage. In the fourth stage, the simple thing is epidermis is injured, dermis is injured, subcutaneous is also injured. Now the ligaments, tendons and bones are exposing. Ligaments, tendons and bones are exposing. Are you understanding? Are you understanding? Yeah. So these are the 4 important stages. Sir, another stage is also there. Yes, it is there. Unstageable stage, which is not included in your textbook, which is update. Okay. Unstageable means you can't able to do the stage itself. Okay. First stage, second stage, you can't place it in any stage. That is called unstaged. Sir, how can you say it is unstaged? It is actually up to the bone, but it is covered with the slough, that means dead cells, and above the dead cells some blackened necrosed part also, that is called eschar. Eschar and slough is covering the fourth stage, then it is called unstageable. That is it. Very easy, right? Are you understanding? Yes. Now we will see one by one. So stage 1, non-blanchable, as I said, it is a pain. Please remember, stage 1 and 2, are the painful. Okay? Stage 3 and 4 not painful. Sir, stage 3 and 4 is very deeper. No, why it is not painful? Because if the wound, if that wound also injures to the, which one? If that wound also injures to the nerve fiber, then it is painless. In the burns you will get it. Okay? But in the pressure ulcer, if in case the nerve is also damaged, that time only the painless. Okay? If it is nerve is not damaged, simply that exposing to the subcutaneous, then it is a pain itself. Okay? Are you understanding? Yes. But most of the cases is painless. Third stage is painless. Please do remember. Okay? So there is no blister, there is, and skin is intact, epidermis is also exposing, and only the reddened color you can see. Okay? Reddened spot. Are you understanding? And there is no skin loss. Now coming to the second one, second stage, there is a shallow opening. Can you able to see? There is a shallow opening, and it is touching, it is continuing up to the dermis. So that means it is exposing the dermis also. Are you understanding? Then it is said to be second stage, where you can see moist wound and also serum filled blister also you can see. So it does not expose any fat. Clear? Subcutaneous fat. I hope everyone understood about the stage 2, and this one is high pain. Which stage is having more pain means you should say that is stage 2 is having higher pain. Clear? Understood everyone? Yeah. Now coming to the stage 3. In the stage 3 you can see there is a painless, and epidermis and dermis and subcutaneous tissue is exposing. Okay, which one is exposing here? The subcutaneous fat is exposing. And here there is a slough also, granulation tissue, some of the mediators, and some of the remaining part of the what we can say debris, remaining part of the debris on the top, that is called epibole, right? These are all is exposing, and it is sloughing, slough also present, granulation is also present. Then we can call it as up to where it is exposing the subcutaneous fat. What we can say for this? Stage 3. Now coming to the stage 4. So stage 4, so here you can see that there is all the superficial to deeper structure is sloughed out, and the only part is visible, that is ligament, bone or tendon. Then if it is visible, then we can call it as stage 4 ulcer. See, stage 4 ulcer will be called as full thickness loss, and stage 3 also will be called as full thickness loss with the subcutaneous, but stage 2 will be called as partial thickness loss. Are you understanding? So stage 2 is also known as partial thickness. Stage 4 is full thickness loss, which is exposing directly bone. It is called stage 4. So due to the stage 4, there are highest complications that may having the risk, that is osteomyelitis, bone infection. Okay? Sepsis, overall body will get infected, and deep infection that may cause deeper infection, and osteomyelitis is one of the deeper infection. Okay, example. I hope everyone understood the stages. Everyone understood? Yes. Unstageable means, as I said, there is a covered by slough and eschar. Eschar means black necrosed part, and slough is a debris which is present over the bone. Clear? Yeah. Now what is the nurse's responsibility? We need to observe how deeper this pressure ulcer is, and how we have to do, what we have to do. So we need to identify, we need to assess everything. That one we have already said. Very importantly, are we giving treatment, or else are we preventing the patient from pressure ulcer? These two are very important. Sir, what we have to say if we are preventing from the pressure ulcer? We have to say that is a primary intervention. We have to say that is a primary level of care. Primary level of care. Are you understanding? Primary level of care means you are preventing the patient from the risk. What are the risks? Fecal matter, urine, and you are not repositioning means then these are risk. If you are repositioning every time, you are preventing the risk. Are you understanding? If you are preventing the risk, that is primary level, and if you are not preventing the risk, then it may get into the disease, it may get into the ulceration, that is pressure ulcer. Now, after getting pressure ulcer, are we going to prevent? Answer is yes and also no. So, yes, because you are preventing the surrounding wound pressure ulcer, and you are treating, no, because you are treating also here, you are not preventing, right. So, I will tell you correctly, this is the wound you think, okay, this is the wound, and these are the surrounding tissues, and this is already wound. For this you are giving the secondary level of care, but surrounding tissues are healthy, no, you are giving the primary level of care. Are you understanding? Are you understanding? That means you are preventing the surrounding tissue to get into pressure ulcer, and the wound you are making management, that is treatment called secondary level of care. Everyone understanding? Yeah. Sir, how we have to understand whether the patient is at risk of the pressure ulcer or not? So, we are using the Braden scale and Norton scale. Sir, which is the modified and most commonly used scale? That is, a Braden scale is the most common scale. Sir, which is the oldest scale? Norton scale is the oldest scale. Okay? And modified Norton scale will be called as Gosnell scale. What you can say? Gosnell scale. Are you understanding? Modified Norton scale is called Gosnell scale. Less than or equal to 16 will be said as highest risk in. We are just assessing the risk. Okay? Is that with the help of the scale, what you will do? You will measure, right? So, we are also measuring the risk, whether the patient is having risk of getting pressure ulcer or not. Are you understanding? Yes. Now, one by one I will tell you the Braden scale and all. So, this is very broader, you can think. Now, I will tell you very easy manner. Okay? Braden scale. For the Braden scale, you can think that is, you know Samantha? You know Samantha? Very nice. You people are, now you people are so much reactive. Huh? Samantha. You know MSN? MSN you know? You don't know MSN? Subject you don't know, you know the heroine name. Nice. Sam MSN. Now, with this help of Sam MSN, what you are going to say, sir? So, Sam MSN is a mnemonic for the Braden scale, you can think. Are you understanding? Sir, from the yes, sensory perception, I am telling the parameters of the Braden scale. Braden scale in the pressure ulcer ultra important. Are you understanding? Braden scale, why it is so important? Because this is the most common in pressure ulcer. Perception, okay. Sir, A means, what is the A means? Yeah, here you can see activity. A means what? Activity. M means you can think that is moisture. Moisture, it will not comes in the Norton scale. Please do remember, Norton scale don't have moisture. Here we have moisture. And another M is mobility, you can think. Let me confirm one side. Yes, it is a mobility. S means shear and friction. Shear and friction. Yes. Shear and friction. Next one is, yeah, next one is nutrition. You want nutrition? Hey, give her water. Give somebody water to her. Why people are doing like that? Are people enemy for her? No, right? Yes. See, these are the, hey, you fight in the hostel, right? Why are you fighting here? Huh? You want to join WWE? No, right? Yeah, Braden scale. So you should remember this. Why the noise is coming now? Yes, Braden scale. So Braden scale is having a sensory perception, activity, moisture, mobility, shear and friction and nutrition. Simple way I will tell you this as SAM MSN is the mnemonic of the Braden scale, and everything is having 1 to 4, 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 but shear and nutrition is having only the 1 to 3 scoring. We are giving the scoring for every, we are measuring, no, we are scoring. Okay. So total we have minimum means how much, what is the minimum then? Can you able to say? If everyone, if suppose you are carrying the patient with a, and you are measuring the patient with a Braden scale. Now you assessed everything and you got every 6 parameter as 1, 1, 1. What is the minimum scoring then? What is the minimum score? Total? Who said that? Yeah, good. That is 6. And what is the maximum score? 4, 4, 4, 4, 3, 4. Yeah, in all 6 parameters, overall maximum score is how much? 20. One parameter is having 1, 2, 3. That's why I said that. Okay. Shear and friction is having 1, 2, 3. That's it. Now tell me, what is the total then? 23. Very good. 23 is the maximum. So after this I will show you the video. Okay. After this I will show you the video. I will end this one. And Norton scale and management, whatever the Norton scale and management is there, I will show that in the next class. Okay. Now listen carefully. Okay. Yes. Now in the Braden scale we need to score it. We know that minimum is 6, maximum is 23. Now less than or equal to 9 is at very high risk. They are at very high risk. They can easily get the pressure ulcer. Yes, 10, next 13, next 15, next 19. Okay, we can say 19 or 18. Wait, yeah, 19 up to 23. See, 19 up to 23, if you are getting 19 to 23, they are not at all risk. They are not at all risk. They are not at risk. Okay, they won't get any pressure ulcer. Okay, they don't have any sensory deficit. They don't have any activity intolerance. They don't have any more moisture, that is bad moisture. Okay, they have a good moisture, good activity, and good sensation. These are all the good activity, and they are getting highest score 4, 4, 4, 3, 4, like that. Okay, they are getting 19 to 23 means they are not at risk. Is that clear? Okay. Now 10 to 12, 13 to 14, 15 to 18. Very high risk is the less than or equal to 9. 10 to 11 is high risk, and 13 to 14 is a moderate risk, and 15 to 18 is a low risk, and 19 to 23 is no risk. Okay, are you understanding? Hereby we have completed the scoring of the Braden. Now what are the scoring, how we are giving the scoring and all, and Norton scale, and about the management, about the prevention, and much more things we will discuss in the next class. Thank you for watching the video.